Thank you for joining me this afternoon. Please, gentlemen, come on over here by the podium. Like many Arkansans, I'm very concerned about the impact and severity of the flu season this year. It's a national story, but it also has impacted us here in Arkansas. I've stayed in regular contact with Dr. Nate Smith, our director of the Department of Health, and his monitoring of the flu season this year, as well as our Surgeon General, Dr. Bledsoe. And I appreciate them joining us this morning, also joined by Dr. Wheeler and Dr. Haslow of the Department of Health, who provides an additional level of expertise. In terms of Arkansas, whenever you look at the fact that we've had 94 flu-related deaths just this year, and on the graph, that's very severe compared to previous years, and is still relatively early in the flu season. Of these 94 flu-related deaths, 2 of those are children. And that is a concern to any parent or grandparent. And so we have to take additional steps to making sure we're on top of it here in Arkansas. And I've asked both Dr. Bledsoe and Dr. Smith to join me today to make sure we're doing everything that we can as a state to prevent the spread of the flu and its impact, and also to make sure that the public is aware of exactly the steps that we're taking as a state. And so with that, Dr. Bledsoe, the Surgeon General.
Thank you, Governor. And I'll just be real brief, but I do want to say that every year we have a flu season in Arkansas, and every year the flu sends people to the hospital for admission and also kills a few people. This year it does seem like the flu season is significantly worse than in the past, and as the Governor said, we've had 94 deaths already, including 2 pediatric deaths, which is a severe flu season by any standard. When we look at the data regarding the deaths, it does seem that this flu strain is targeting the extremes of age and those with chronic medical debilitating disease, as in past seasons. And we would just like to encourage the public to join us in some of our preventative measures that are recommended for preventing the spread of flu, such as the flu vaccine, which isn't 100%, but certainly does slow the transmission of the disease and decreases the symptoms if you do get infected. Proper hand washing, so being obsessive about washing your hands, not touching your mouth, not touching your nose, being careful about touching other people, and if you sneeze, sneezing into your arm or into your elbow, and making sure that your hands remain clean. Those are just a couple of the things that we recommend. And if you do happen to get the flu, we recommend that you stay inside. You can take Tamiflu if your doctor recommends it, but don't go out into public places until you've had at least 24 hours of being fever-free. So a few recommendations to help prevent the spread of flu and to try to get our arms around this flu season. And with that, I'll turn it over to my friend and colleague, Dr. Nate Smith, Director of the Health Department.
Thanks, Greg. This year, Arkansas has been particularly hard hit by flu. As the Governor mentioned, we have 94 flu deaths reported so far, including 2 children. Typically, we will see about 2/3 of the deaths reported after the peak of flu season. We've not yet reached that peak in Arkansas. Elsewhere in the country, it looks like we may have crested. Here in Arkansas, we've not quite seen that yet, but we're hopeful within a week or 2 we'll see a significant decrease in the number of cases. It's not too late to get a flu shot. Typically after Christmas, it's hard to get people excited about getting their flu shot, but this year, if you haven't gotten it, it's high time to do so. There are 4 different circulating flu strains this year, and all 4 of them are covered in our vaccine. The one that is predominating is an influenza A. It's called H3N2. That particular flu strain tends to hit older adults most heavily, and indeed this year most of our flu deaths have been among older Arkansans. Dr. Bledsoe mentioned that there are certain individuals who are at higher risk of complications and hospitalization and even death from influenza. Those include the very young, very old infants, older Arkansans. Pregnant women are a high-risk group, should be vaccinated, definitely. Also, those who have a weakened immune system or who have various medical conditions like heart disease or diabetes definitely should be immunized, definitely should get the flu vaccine. Also, those who smoke or those who are exposed to secondhand smoking are at higher risk for complications and death from influenza. Not only should those folks be prioritized for flu vaccine, but if they do develop flu symptoms, they should go to their physician and, based on their physician's advice, should at least consider being put on an antiviral like Tamiflu. And the sooner that started after the onset of symptoms, the more likely it is to be effective. So those who are in those high-risk groups who have flu-like symptoms should go in early and hopefully will prevent complications. In addition to vaccination, coming in early for those with high risk and getting on Tamiflu or another antiviral, some practical suggestions for preventing the flu that all of us can do. One is hand washing, either with soap and water or with an alcohol gel. Dr. Wheeler, I think. There we go. I'm not promoting one brand over another, but also, as Dr. Bledsoe has mentioned, avoid touching your mouth, your nose, your eyes, because that brings things from your hand into the rest of your body. And then trying not to be around those who are sick. As has been mentioned, those who do have symptoms should wait until they've been at least 24 hours without fever, off of Tylenol or something else that suppresses the fever before they return to school, work, or other public settings. So there's a lot of things that we can do to reduce our individual risk, and lots of things that we have done in terms of influenza vaccination, getting the word out that can help us as a state. Hopefully we will see a decrease in cases soon, but we'll continue to monitor the situation very, very closely. Thank you.
I'll just add before we turn it over to questions, the Department of Health does a very comprehensive report concerning the flu this year, and what struck me was the rate of absenteeism in our schools, and the county that hit me as having the highest rate was Scott County with almost 13% absenteeism rate. And so that's another thing the Department of Health is watching, and obviously parents are concerned whenever you have that level of flu or absenteeism in our school systems. With that, we happen to turn it over for any questions you have.
Governor, I guess, and really more for the doctors, is there a particular hotbed? I mean, is it all 75 counties, or are there pockets that are just worse either because of people or the type of strain that we're seeing?
We've seen flu in all of our counties, so it's hard to say that there's one more than the other. Where we have the most number of flu cases reported from in terms of positive tests tend to be where we have the largest number of people, Pulaski County, for example. With regard to schools, as the governor has noted, school absenteeism is a major factor. What we have found is that the schools that have the highest rates of influenza vaccination in the fall tend to have the lower rates of absenteeism during flu season.
And doctor, do you attribute anything specifically to this flu outbreak being significantly worse than previous years?
Question is, why is it worse this year than previous years? That's a difficult question to answer. I don't have a good explanation for that. This is an H3N2 virus that's predominant, and we've seen that in previous years, although it changes a little bit each season. It's a complicated interaction between changes in the virus and our susceptibility as a population. We have an H3N2 component in our vaccine. It doesn't look like that's been as effective in this year's vaccine as in previous years. I'm not sure that's the entire cause for the worst season this year. As a plug, what we really need is a universal flu vaccine that would cover all strains and be highly effective year after year. We don't have that. That's an area of active research, something that probably needs to be a high priority for us as a nation in terms of our scientific investigations.
And last thing to follow up, do you believe that we're approaching the worst part of it, or it's about to get better? Tell me that again.
Typically, we will see flu seasons peak for about 2 or 3 weeks. This season, it's been longer, but typically it won't stay this high for too much longer. We're already have started to see a decrease in the number of outpatient visits, the percentage of outpatient visits that have influenza-like symptoms. We're starting to see sort of a flattening of the ER visits, and so hopefully we will, like the rest of the country, start to see a downward trend within the next few weeks. But it's really hard to know.
We end up with having still with 2/3 of the deaths to come. We end up with like 270 deaths. What would be the most recent year that was comparable to that?
We really we haven't seen anything like that for as long as we've been keeping careful records of flu deaths. Just going back the last 17 years, that would far exceed anything that we've seen.
Might add, right now, correct me if I'm wrong, Dr. Smith, but we're at the second highest in those 17 years in terms of flu-related deaths. And with the late reporting, I think it can be anticipated safely that we're going to exceed those previous numbers, and this would be a record high. Is that?
That's correct. That's correct. And to get numbers above 200, as you mentioned, which we very well may see, expect to see based on where we are at this point, you'd have to go back decades. And of course, the way of ascertaining deaths at that point, that far back was much different than what we do now, and the population was smaller. This is going to be a record season, I expect.
Do you have I don't want to say target figures or anything, but do you have a concrete number that you would fully expect based on what we've seen today?
Again, based on past trends, you could probably triple our current number and come up with something close.
A question I get often with the multiple strains out there, a family that has one strain that just recovers, are they susceptible to getting the flu a second time?
Certainly, with 4 different strains out there, someone could get flu more than once in a season. If they have the vaccine, then they're much less likely. Again, this year, it's not been as protective against the H3N2 as we would like, but the protection against the other 3 strains is better. So, flu vaccine, even for people who have already gotten the flu this season.
How do you combat the reluctance for some people to have either themselves or their children vaccinated? I know it's not limited just to flu, but how frustrating is it, and how do you combat that?
This is a challenge because flu vaccine isn't really very effective if someone doesn't get it. In the past, we've focused on the personal protection aspect of it, and that's very important, especially for those who have risk factors for complications. But we've also focused on the protective aspect towards your loved ones. We know that people begin shedding flu virus, they become contagious to others at least 24 hours before they develop any symptoms themselves. And there are many people who become infected, can potentially spread the flu to others who have either minimal symptoms or no symptoms that they recognize at all. So you could have a healthy person like myself, and I have had my flu vaccine this year, so if you're going to ask that question, I'm immunized. But if I got the flu, maybe it was mild, maybe I don't have symptoms at all. but I go spread it to other people, especially older Arkansans who have risk factors, babies, pregnant women, smokers, and I may be fine, but they're not. Whereas if I have my flu vaccine, I don't get the flu, I don't spread it on to other people. One of the reasons why we have focused on school-based clinics is one, to reduce the absenteeism so that we can make sure our children are getting a quality education even during a severe flu season, but also because children can take the flu home and spread it to grandma and grandpa, or the baby, or the pregnant mother. And so by preventing them from getting the flu, we also are protecting the community as a whole.
Doctor, I know we're still kind of in the middle of it, but is there a lesson to be learned from this flu season?
I think there are some lessons to be learned from every flu season, particularly heavy flu seasons. One is the importance of flu vaccination. And unfortunately, people don't think of it sometimes in the fall when we're rolling out flu vaccine, and then are thinking of it after flu season is hit hard. And the second is the importance of taking measures to protect our whole communities, that this is not just an individual thing, we're all in this together. Those of us who are healthy really should consider taking those steps to prevent spread of flu to others. We may be fine, but someone else may end up hospitalized or worse.
Once you get the flu, how long are we talking about you being a contagious person?
That depends a little bit on the on how severe it is and how strong the immune system is. But I've got some experts here. Governor, do you mind if I introduce Dr. Gary Wheeler? I have Dr. Gary Wheeler, Chief Medical Officer at the Arkansas Department of Health. Gary is a pediatric infectious disease and immunology specialist. And Dr. Dirk Haslow is our state epidemiologist. He's also a pediatrician and has a doctoral degree in infectious disease epidemiology. And I'm going to turn it over to them to give you some of the best answers.
So the specific answer to your question, the normal person is that typically you're infectious for a day or so before you break out with classic flu symptoms, and then it lasts typically about 5 days. It's variable within individuals. Some people will not have any symptoms after 24 hours, and we usually recommend that if folks want to go back to work or go back to school, they need to be without any symptoms for at least 24 hours, and that's on no Tylenol or ibuprofen or whatever. However, individuals who are ill with underlying diseases, that can include things like leukemias or other kind of things, they can continue to secrete the virus for long periods of time. And most hospitals are aware of that and will continue isolation of those individuals for extended period of time. Does that answer your question? Okay.
Out of the people who have died, do you know how many of them have been immunized?
We don't have complete information, but I'm going to have Dr. Haslow address that question.
Sure, that's a difficult question to answer. Part of it is that our immunization record system is very well and reliably used by pediatricians and family medicine docs who treat children, but doctors that treat adults haven't fully incorporated that into their scope of practice. So we do, with every death we become aware of, we reach out to the physician or the facility where that death occurred to see if they know. And if we can get that information that way, we do it. And after an acceptable time has passed, we call the family and ask. With that effort so far, we have identified among the 94 deaths that a third of the individuals were vaccinated. That is lower than the vaccination levels in the general population. So we interpret that as, unfortunately, opportunities missed to be vaccinated.
Is there any strain that's particularly stance?
Some strains are more likely to cause illness in different groups. The influenza B strains are more of a problem in children. The influenza A strains, the ones that are characterized by the numbers H3N1 or H3N2, that sort of thing, those are can cover all age groups and populations. But generally, people are potentially vulnerable to all of these strains unless vaccinated.
Is there anything that's particularly hit in this state the hardest?
Yes, H3N2, influenza type A, H3N2, which is whenever that type of strain dominates in the U.S., it's a much worse season in terms of deaths nationally.
How are we comparing to the states that are surrounding us right now?
Okay, I'll keep going. We are generally higher than our surrounding states. Using some metrics, we have been thought to be second highest in terms of rates in the nation. So it's a bad season here, particularly bad here.
Is there anything that's in our atmosphere, humidity, the type of winter we're having, or anything that y'all can put a finger on and just say that could make a difference?
No, we wish we could.
All right, your last question.
Can we go off topic?
We need time.
Yes. Are you ready? You got another question on this
Yeah.
topic? Last, okay.
To go off topic, one question and a follow-up. Have you received a letter from Jake Files regarding this?
I've not received that. To my knowledge, we checked shortly, and I have not received it yet.
How does this impact the Medicaid vote with the vote last time through being tough on the expanded Medicaid legislation? Is planned for perhaps maybe doing a special session if that seat or that vote isn't available come next month?
We're still optimistic that with the reforms that are in place that we'll be able to pass the DHS appropriation in regular order. We'll continue to monitor that and make decisions accordingly. We're still waiting for our notification from Washington in terms of the work requirement waiver and other items that were requested, but we've had the reforms that's really accelerated the appreciation of the legislature for what's happening and more confidence. We'll continue to watch it. It doesn't help that we've had 3 senators that were previously yes votes that are no longer in the Senate.
And talk about your take on the general improvement funds. Here's another case of alleged misuse of those funds. Your perception, your thoughts on that?
Well, as I've indicated before, it's just another illustration that whenever you have general improvement funds that are dispersed without sufficient controls, that they can be misused. And there's a history of misuse, even though there's many legislators that have used it appropriately and carefully and wisely. But it has been abused without any question. For that reason, by agreement, we had $0 in general improvement funds the last session of the legislature, and I would be supportive of a complete prohibition on that to make sure that this is not abused in the future. All right, thank you all very much. Well, let me tell you, that had a lot more interest than my normal